I'm Dr. Sonia Jessup and I'm talking to you now about labioplasty. Labia are very normal parts of a woman's anatomy, and most labia are not symmetrical. One side will be slightly bigger than the other side. But for some women, this is quite a marked difference, and sometimes both labia will be much bigger than the woman finds comfortable in exercising or day-to-day life. There are multiple ways that labial surgery can be performed, from trimming the outside of the labia to performing a wedge excision. It is important to realize, though, that the end result will never be 100% symmetrical. Labia are not symmetrical in terms of every fold from the top of the vulva near the clitoris to the posterior fourchette. If you are considering having a labioplasty or having labia surgery, it should be for your own personal reasons, not because you think somebody else doesn't like the way the labia look. The labia can certainly be approximated to a normal size, and for a lot of women that's labia minora that sit within the labia majora, or the outer lips of the vagina of the vulva when they are at rest. Having a labioplasty type surgery, however, is not minor surgery. It does involve some planning and some ability for downtime after the surgery. It is really important that women abstain from sex and abstain from exercise while the labia are healing. To perform these procedures correctly, there are lots of very, very fine sutures placed, and these sutures can be damaged with vigorous exercise. Labioplasty can be performed in the rooms or in theatre, depending on a person's preference. And a trim labioplasty versus a wedge labioplasty may be preferable for different reasons. Women who don't like lumpiness on their edges of the labia or don't like discoloration on the edges of the labia may be better suited to having a trim labioplasty. Other women who just are concerned about the size of the labia may be better suited to having a wedge resection of the labia. If you have any concerns about your labia, it's a good idea to see a specialist who can go through the pros and the cons of doing labial surgery. Many of my patients have labial issues and are extremely happy with the outcomes, but recovery is the key to a good outcome. Sometimes labial wounds will come apart or dehisce, even with the best surgical techniques, and they will need to be repaired, and this can be expected. But giving yourself the most optimal time to rest afterwards decreases the likelihood of this happening. If you have any questions or would like any further information about what I've talked about today, please feel free to call the clinic or to email us on our email address. Many women feel anxious or are not sure what they may be getting themselves into, but talking to our reception staff or nursing staff will help you think about whether it's the right decision for you. So any questions at all, please contact us and we will be as helpful as we can in providing the information that you may need in deciding which steps you want to take going forward.